Good evening to everybody. Thanks to Dr. Ajayan and IASMP for giving me this platform. After hearing the exhaustive lecture of Dr. Prabhat, I don't have anything much to say. What to say? Like that. Sorry. And Dr. Tareja and Dr. Raj Prabhat covered everything. I am Dr. Murugan. My specialty, my degree is confined to venereology. Venereology, a separate specialty, was there in Tamil Nadu and Andhra Pradesh 2 decades ago. I was one of the venereologists, even though I am practicing dermatovenereology. When I was doing my venereology practice in UK, the same branch is called as genitourinary medicine for some time, and anything pertain to genitals. So when I started my clinic regarding genital specialists, a lot of cases have been, I met sexual problems, and I developed my interest towards sexual problems. I happened to hear the lecture from Dr. Prakash Kothari that made me to become a sexual medicine specialist. I am practicing the sexual medicine practice for the past more than 3 decades. I am not going to stand in between you and other speakers for a long time, because already it has been dealt exhaustively about the management. From the management, everything is covered by Dr. Raj Prabhat and Dr. Tareja. Now I will confine myself to only my experience with the pre and post era of the PDE5 inhibitors in the practice of sexual medicine. Even everybody, can you imagine? Can you live one day without your mobile? So we have lived, almost everybody have lived without mobile phone, without Wi-Fi, without internet. But can you imagine now? Can you live without the Wi-Fi? Can you live without the mobile? So previously we used to communicate with the postage and even telegram and other things. So we did communication, received the reply within a week after the, it was within, whether it is within the state, fortnight within the country, and it may take even 2 months to get the communication from other countries for abroad. But now I can call immediately and communicate and chat with the video call with individuals from every nook and corner of this world. Similarly, the advent of PDE5 inhibitors made wonderful with the results more precise and reliable and quick. Now we feel without this children, that is the PDE5 inhibitors, it is very difficult to practice. But we had sex is in between 2 ears, not in between 2 thighs, as believed by many. Yes, sexual function and sexuality are concerned with mind, physical stimulation, and seeing, fantasy, imagination, everything confined to mind. So any type of thoughts or beliefs which are persisting in the mind will interfere with the completion of the human sexual cycle response, sexual response cycle. 90% of my cases still, even prior to PDE5 inhibitors, are now 90% of my cases are related to some sort of psychosexual dysfunction rather than organic. Even with the people of middle age, with or without comorbidity, also would have some sort of psychosexual problems. I used to feel difficult in treating a case who are on antipsychotic drugs for months or for years, like schizophrenia, some depression, mania, something like that, in whom it is very difficult to put them back to normal in their sexual life. Like that, anti-epileptic drugs, who are lifelong, sometimes more than 5 years, 6 years, 7 years, the anti-epileptic drugs, phenytoin, sodium, guanidinol, like that. So these people also will be very difficult to put back to normal. And mentally retarded people. So that is another category which I find very difficult to manage. And of course, that says different sexual orientation, that we have to accept it and we should not try it. So these are the things. The other 90% of the cases with psychosexual problem had been treated successfully both in pre and post PDE5 inhibitors. The thing is, with the presence of PDE5 inhibitors, the patients gain confidence easier and we can put them back in normal mainstream earlier than the time without these drugs. Intracaverous injection I used, but very minimally. In those days, I was not aware of bimix or trimix, which are mentioned by Dr. Tareja, and he is expert in that. But at that time, I used to give plain ribavirin injection. Even though it was said it has a high toxicity or something like that, I don't come across any much toxicity, but my experience is very limited with the intracaverous injection. Drugs in my basket in those days, pre-PDE5 inhibitors, are my pharmacology books taught by me, as said by Dr. Brahmvat and Dr. Tareja, that is strychnine and yohimbine are having aphrodisiac effects. Strychnine is a neurotoxic, highly neurotoxic, so became obsolete. So preparations containing yohimbine were my choices in the PDE5 pre-PDE5 inhibitor era. As rightly pointed out by Dr. Raj Brahmvat, Himalaya pharmaceuticals have different types of combinations to treat individuals with sex problems. Tentex Forte, then Tentex Royal are available still as aphrodisiac to treat erectile dysfunction. Tentex Plain and Spearman were available to increase the quality of the semen. And tablet Confido was available to treat premature ejaculation. So most of them, you can ask whether really that these drugs were useful. Usually, the proper counseling, when you approach the patient in the proper way, history taking, counseling, understanding the problem, explaining this, along with all these drugs definitely had worked well. Tablets Mustang and some other companies were also having drugs containing yohimbine. Himcolin is as rightly pointed out by Dr. Raj Brahmvat, it's a topical application available previously pre-PDE5 inhibitor era and also now also. I am using the Himcolin almost for all my patients, even that is a PDE5 inhibitor era and also now. You can ask me, are you sure whether it is working well or not? I cannot say confidently with evidence-based, but most of my patients, when they are applying, I used to ask them to apply daily and they have 1 minute slightly massaging. So patients feels better. They are applying something over the penis and it has some effect. Along with the other supportive drug, other things, the Himcolin works well. Till now, I am using this Himcolin gel. Anxiolytics, of course, useful in premature ejaculation and also for the pressure performance and other many conditions. Local anesthetic creams for premature ejaculation had been used at times, not always, because sometimes it may steal the real pleasure. Counseling, that is very important, whether it is pre-PDE5 inhibitor or post-PDE5 inhibitors. Patient hearing is problem, complaints, history, understanding their exact problems, alleviation of their misconceptions, and clear the myths, along with suggestions, are mainstay in my sexual medicine practice, which helped me to put them back to normal. That works out well. Post-PDE5 inhibitor era, sildenafil citrate is the first PDE5 inhibitor came to the market. action proved beyond doubt, whereas the drugs which were used by me in the pre-PDE5 inhibitors, I am not sure how far it is working. But this is beyond doubt evidence-based. And initially, it was available only as on-demand drug. Of course, patient felt better, obviously makes our job more easy. Then tadalafil came to the market and is available as low dose for regular use with the lesser side effects, and also available for the use of on-demand dose also. It's a regular dose and also for on-demand dose also. So it is more safer, especially elderly patients and the patients with the comorbidity. So of course, this is very useful. This regular low dose tadalafil makes the patient feel better with the early morning erection and increased libido. The patient confidence level increased, obviously. When the patient is put on abstinence and also sensory focus, along with that, when we are giving this regular dose, his moods will be elevated, he will be stimulated, he will be longing for sex. When we are allowing after abstinence, they will be doing better, definitely. Supportive drugs, along with appropriate counseling, they gain confidence level with the PDE5 inhibitors, which put these patients back to normal level. Supportive drugs containing naturoceuticals, that is fenugreek seeds, extract, Triples tertius, ashwagandha, ginseng, ginkgo biloba, and products containing L-arginine, etc., are potentiates this management. Nanoleo, Elevate Neo, Libidup, Eractex, these drugs takes the treatment to the next level. The role of testosterone. Testosterone was available both during pre and post PDE5 inhibitors era, have a definite role in the tackling ED problems. Parenteral preparations are preferable than the oral preparation. I use injection testosterone mainly for patients above 45 to 55, not after 45, 55. Usually the middle age, there will be a low dip in the hormone level. Along with other drugs, this testosterone will be of definite use, and cautiously after the age because of the possibility of prostate cancer, prostatic pathology. This will bring good results when we institute after estimating the hormone levels. If there is an indication of hormone low level of testosterone, there is a definite indication for testosterone injection. When there is obvious signs of hypogonadism in young individuals, loss of secondary hairs, development and other things, sometimes after this using that hormone levels, I used to give this testosterone for short span, not for longer time, because it will definitely interfere with the spermatogenesis of that individual because of the reverse feedback mechanism, hypothalamus and pituitary axis. Problems faced during pre and post PDE5 inhibitors. So this is one of the important things I encountered. During pre-PDE5 inhibitor era, patients used to come with a history of rampant and irrelevant use of testosterone preparations, either oral or parenteral was there. These made these individuals infertile often, and they will be already exhausted with the use of this testosterone. Every gender practitioners used to give immediately pre-PDE5 inhibitors, they will immediately start the patient on testosterone. So this is one of the worst problem we face. Leads prostate problems also. Similarly, in the post-PDE5 inhibitor era, the most patients came after using sildenafil citrates for months or even years, either on their own or through their suggestions from their treating physicians. Overdoing, ignoring the refractory period of the penile erectile system, the total exhaustion of the system, fatigue of our erectile system, especially with the middle-aged persons, are being encountered. Of course, treatment of the comorbidity like diabetes mellitus and hypertension with the appropriate good drugs also will be very useful. So these are the some of the experience of mine in the pre and post PDE5 inhibitors. Thank you very much.